It's been a morning. Um, Again, my name is Lisa Mills. I want to welcome you to our presentation today. I am one of two training specialists with the Child Care Center Licensing and Certification Unit at DHS. Today, we are presenting applying for certification for child care centers that qualify as license exempt. Today, we will cover the kind of what certification is, what it means, um, and then the application process. We will literally walk through the process that an applicant would go through in the provider hub to give clarity of what the expectations are. We I will be presenting today with my fellow training specialist, Rena Larson. She was just on there with you. Today, we also have our licensing unit assistant manager, Michelle McGregor, our certification supervisor, Carrie Leith, and then we have a panel of a few of our certification licensors. We have Michelle Hatlily here, Heather Roman, and Michelle Chapin. We also have a couple guest speakers today. We've got Brianne Peterson from CCAP, the Child Care Assistance Program. And we have Katie Lane, who will speak directly about the Provider Hub and the resources that she and her team of colleagues have developed to support applicants. So again, Rena and I will be presenting the bulk of today's material. And we have this great panel sitting by to answer any questions. And so do know that I want to move on here. During today's presentation, it is being recorded. We have an accessible handout that we sent out. I sent it out yesterday from our training team specialist email. So if you get that email, you know how to get to Rena and myself. That handout is designed for you to use as a resource after this presentation to kind of like just be reminded of some of the links and additional ways you can get information about this process. We are recording this. We are deciding whether or not we will post that recording or do know that we offer this training a couple times a year. And so we will be, offering it again in 2025. So that all being said, again, our panelists are here to answer your questions. We have lines muted so that we can get through all the information today, but we truly encourage your engagement through questions. So we have the chat feature available for you, and we ask that so everyone can understand and kind of learn through your questions that you ask your questions to everyone so that we can see them. If you send a question directly to me or directly to the other hosts in this presentation or speakers, we may not see it because again, lots of things are going on as we're presenting. So the best way to reach us is to use that chat, send it to everyone, or if you're not comfortable doing that and you have a private question, at least send it to the panel. And our panelists will work their best to answer any questions today. After this presentation, a brief summary or a survey will pop up. And with that survey, we just ask for your feedback because, again, we do present this routinely. And with that, we like to make certain that anything we may have missed or anything you want to know more of is provided. And so we update each time we do this. This is a develop approved training. And with that, this training, if you have a develop account and have provided that during registration, Rena I'm going to give her credit for it because she is going to add a membership, attendance to the learning records tomorrow. So give us a few days to get that to show up on your learning record. And if you've stayed on for the entire 2 hours, you will get credit for that. If you have not got a develop account and you want more information on that, develop is an easy, Minnesota Develop tool is a way to search for develop. And we have information about develop and in our resource guide that we've provided you with again for today. Let's see. This presentation is what it is an overview of the certification application process for childcare centers in Minnesota. We will be here to provide you with some insight to requirements of becoming a certified childcare center, information about available resources that are out there to support you, and certified programs. And this presentation is really just, designed to be a connection between our unit and you, to let you know that we are here to support programs as they go through certification. And once they are certified, that is really a key benefit to becoming certified. And we want to make ourselves available to you. What this presentation is not is a replacement of all of, everything that a certified program will need to know to govern a certified childcare center in Minnesota. However, we do connect you with where to find more information for that, but we like to make sure people know that. It is not a comprehensive information on everything you need to know to open a childcare center and or operate it. We're not here to give legal or business advice, and we're not providing, advice on activities, curriculum, or quality above and beyond certification minimum standards. All right. What is certification and who are we? So I want to give you a little information, about what childcare certification is and how it landed in our childcare center licensing units oversight. Back in 2014, the Federal Child Care Development Block Grant reauthorized changes that required states and child care providers who access child care subsidy funding to either be licensed or choose to go through a certification process if they are eligible to not be licensed. So, a little more on that. Um, One of the new federal requirements of this reauthorization that all providers receiving child care subsidy funds, like Minnesota's Child Care Assistance Program, must meet certain health and safety requirements, such as a background studies of child care staff, pediatric first aid and CPR training, and annual monitoring visits. So for Minnesota, that meant our license exempt providers had to go through the process to show that they meet some minimum health and safety requirements outlined by that federal child care development block grant. And this is why Minnesota established child care certification for those programs that are exempt from being licensed. To learn more about the federal child care development block grant, we have provided a link to where you can find more information on federal rules for health and safety. And it is the link here is, written out on this slide, but is also provided in your handout. This visual here that I'm showing is kind of a graphic to help people understand again what license exempt childcare is, and how it fits into the puzzle. So Minnesota, first of all, has laws in place that start out by requiring that all child care provided needs to be licensed unless an exclusion is met. So there are nearly 1,800 licensed childcare centers in Minnesota and over 6,000 licensed family childcare programs. So those are all monitored for compliance with licensing statutes and rules. However, again, law has created some exclusions to those programs or programs providing childcare that do not require being licensed. And so if a program meets one of those exclusions, they are able to operate. Those exclusions from licensing are listed in Minnesota statute section 245A.03. During that 2014 reauthorization of the federal child care block grant, changes were enacted that required states again to become compliant with federal requirements to ensure child care receiving funding meets certain health and safety standards. So then in 2017, during the legislative session, state legislators enacted changes to bring the state of Minnesota into compliance with those federal child care development block grant requirements, including license exempt centers that participate in Minnesota's Child Care Assistance Program be required to be certified under Minnesota Statute Chapter 245H. So for programs that operate in homes that are exempt from being licensed as a family childcare, they would need to be registered as a legal non-licensed provider. So that's much like certification in those license exempt centers, but for a licensed family childcare situation or license exempt family childcare situation. So if a license exempt center opts out of certification or license exempt home caregiver does not register, they are not eligible to receive payments from child care assistance. And now some of the other federal and state funding that are occurring. So the Minnesota Department of Human Services Licensing Division became responsible for also monitoring our certified child care centers. And so those license exempt child care programs in home, those legal non-licensed providers, are monitored directly from the child care assistance program. So again, our licensing unit has a specific group of licensors that are specialized in monitoring our certified programs, our certified child care centers. This here is a very busy visual graphic of some of those exclusions from licensure. But as I stated again, you can read all of those exclusions to being a licensed childcare program in Minnesota Statute 245A.04. I just want to stress too, again, unless a program meets an exclusion, they do need to be licensed. And again, if they meet an exclusion and want to participate in CCAP or receive some other great funding resources, they would need to become certified. Now, if you want to learn more or read 245A or 245H, which is again specific to certified license exempt childcare centers, we wanted to point out that the Minnesota Legislator's Office of the Reviser of Statutes has a website that is really great to and easy to navigate. You can search any statute, law, or rule within Minnesota and kind of read through the specific language that is used. And so we wanted reference to that. And again, any of these links that we are talking about are provided in those handouts that we've sent out already. And I do want to note on that handout, if you did not receive it, you can jot a note in the chat for our panel, and they will either send it out to you, or Rena and I will also monitor the chat after we are done presenting and send it out to anybody that didn't receive it that is not getting it now. All right. Besides this webinar, to learn more about certification, the Child Care Center Licensing and Certification Unit has a website devoted to certified centers, and that can be found by visiting minnesota.gov, well, mn.gov/DHS/licensing-certified-centers, as shown here. This site contains information on how to contact us, requirements for certified centers, forms and documents for certified centers to kind of help monitor and keep track of certain things, and guidance and links to the application within the Provider Hub. And then you might ask, I know a lot of you are already operating as license exempt programs. So you might be asking, why become a certified child care center? So besides the obvious that we said that it is a requirement to participate as a CCAP recipient, and we're going to hear from CCAP soon, there are other great benefits. So certification and being certified improves the recognition of programs for families and the public to recognize a program as being certified. So it's a great marketing tool. It's a great way to reach people within the community because they may be looking for programs that are certified, especially if they participate in CCAP or other fundings. And it's great because there are some minimum, health and safety standards that are very easily spelled out for programs to achieve and comply with. And that's great for all children and families. And it really helps to guide your programs and understanding how to operate. With that also comes ongoing support from us, from our certified team. Our certified licensors are so amazing, in my opinion. I think they're great. They're super dedicated to supporting all of the programs that they work with and serve, and they're very friendly, they have great knowledge. And so not just about the compliance, but just, as a support to the programs out there operating. I know they work very closely with a lot of the center operators to helping them understand, what is required. So they will provide technical support on certification requirements. They offer help with a variety of questions or connection to other resources that are out there and information that you might not know about if you're not operating and have those connections. There are yearly reviews for compliance that are announced and coordinated between our programs and our certified team. So that allows for that connection year round if needed. During those visits, and again too, they do make themselves available year round. So if you have a question even between a visit, they're there to kind of support you and help you better understand what is required. Becoming certified allows your childcare program to again enroll as an eligible CCAP participant program, allowing for more equitable access to children all throughout Minnesota. Um, you know, it, Quality care is really important to the residents of Minnesota. And so having certified programs allows communities to really know that that is a good resource for families and children. Also note there has been increased attention and understanding of the importance of childcare and the major impact it has on communities. And so more people are interested in knowing what is out there and what a quality program might look like. And so that's another reason becoming certified is really allows for that connection again within your community and access to those national trends and information that is coming out about quality childcare and early education. As I mentioned, you can market your program as a certified program, and there are grant and compensation payment opportunities. You're going to hear a little bit more about that in a couple from our next speaker. And also, too, with participation and certification, it allows for engagement and for your ideas and voice to be really elevated and heard. And so you can connect with us. We, as a state agency, really are committed to hearing from all of our providers. And what we hear, we truly do bring back to our team, as well as the larger agency that we work with and work, the rest of them and others that we work with. So at a state level, we can really bring your ideas forward. And there are many ways for participants to really become engaged too. So we are always asking for programs to share and be part of different opportunities. So the Minnesota Child Care Assistance Program, we need to change that because our Child Care Assistance Program now in Minnesota has transitioned over to our new state agency, and you'll hear a little more about that throughout the Department of Children, Youth, and Families. And so this slide needs to be updated because childcare assistance is now part of DCYF. And our licensing and certification unit too is transitioning in by June of 2025 to the Department of Children, Youth, and Families. So if there's little confusion, we are part of our licensing unit, certification unit is part of DHS currently, but we are all moving to that new agency, Department of Children, Youth, and Families, and so that all of our services can be more coordinated and more easily accessible and to residents of Minnesota. I'm going to pass things over to Brianne Peterson. Brianne is here from the Child Care Assistance Program, and she's going to share information about child care assistance and some of the work that she does for our state and for residents. So Brianne, thank you for being here and take it away.
Thank you, Lisa, and thank you everybody who's attending today. Thank you for considering certification. My name is Brianne Peterson with the Child Care Assistance Program. I'm a policy analyst for this program, and here today to just share a little more information about two programs that you would have access to as a certified child care provider. So the first is the Child Care Assistance Program, as Lisa nicely gave an overview of in some of those previous slides. And I also put a link in the chat to our webpage. And I'm going to reference a couple different documents and resources that are on our webpage in the next few slides. So first, just some basic information about the Child Care Assistance Program. It's a program that helps low-income families afford childcare. And in the last year, we helped 12,000 families, and that meaning 22,000 children, access safe childcare environments. And we work together with 3,700 different childcare providers, including 550 certified providers, to give children access to those childcare environments. So families who use childcare assistance, they must find a provider who accepts childcare assistance, who's registered to receive payments for childcare assistance. The registration process itself is really quite easy. I'll talk about that on the next slide. And by taking that step to register and work with families using childcare assistance, your program is really demonstrating a commitment to equitable and accessible access to childcare for all Minnesota families. Without certified childcare providers, many low-income families cannot access childcare. And we actually here in particular, families are looking for those certified sites, those before and after school programs, summer programs. So it's really important to them, and I'm just really happy you're here today to learn a little bit more. Like I said, the registration process is pretty easy. I am going to be talking about what's happening currently, and then we're actually going to be changing the process come April 2025. So you cannot register with the Child Care Assistance Program until your certification is active. So that's step one. You become certified. Once you have your active certification, you can register. And if that happens before April 2025, you will have to contact a CCAP agency. Those are usually counties, tribes, or other organizations who administer the Child Care Assistance Program. And so what this results in is sometimes providers have to register with multiple agencies. For example, I used to be a child care provider here in the metro. I was in Hennepin County. And most of our families came from Hennepin County, but we also had to register with Ramsey, Dakota, Anoka, some other counties on or off. It just depends on the families you serve and where they live and where they receive their child care assistance. So you'll know that once you're working with families, but a good bet is to register with the county that you are located in. The registration process is a packet that's either mailed or emailed to programs, and then you work with the county to just complete that registration packet. The packet is on our website under the registration headline, so you can take a look and see what information you need to provide. It's mostly basic program information, going through some acknowledgments and attestations. We do ask for a W-9 form, but it's all pretty simple, straightforward stuff. Starting this April, CCAP registration is actually going to be available in the Provider Hub, which I know that you'll get to see a little bit later in this presentation. So we're hoping that makes the process even easier, even more smooth. And because of that transition, well, we're also going to be able to shorten the registration because we can get more information from the certification team. And then the other change is come April 2025, that registration will actually go to the Department of Children, Youth, and Families. So after April, providers will no longer have to register with multiple counties or CCAP agencies. You'll just register with the Department of Children, Youth, and Families, and then every 2 years, there's a renewal process. So once you're registered and working with a family that uses child care assistance, you will get paid by the Child Care Assistance Program. And the rates that the Child Care Assistance Program can pay are either what you charge as a provider or the applicable maximum rates. So if you charge more than the CCAP maximum rates, we have a maximum that we'll pay, so families are responsible for that difference. However, our maximum rates did increase within the last few years to the 75th percentile of a market rate survey. That's a survey that collects as much rate information as possible from as many childcare providers as possible. And being at the 75th percentile means that in most cases, the Child Care Assistance Program is paying the full rate of childcare for 3 out of 4 providers. So pretty likely that CCAP will actually cover the full rate, but not in all cases. What you can do is we do have a link to our maximum rate documents on the web page. It's under the reimbursement information. So you can take a look and see what it looks like for your situation. The rates do vary based on the county, the age category of the children, what kind of provider you are, and then whether your site has an accreditation, credential, or parent aware rating. If you are 4-star parent aware, there's a 20% quality differential, so that adds up as well. And we are going to have new rates that go into effect January 2025. They are being updated to reflect the most recent market rate survey. And then after January 2025, we expect the next rate increase to be January 2028. Every 3 years, it'll be updated to reflect the most recent market rate survey. So you can just keep an eye on that website and see the new rate information as those come. When you are a child care assistance program provider, there are a few additional record keeping requirements. I'm not going to go over all of them, but I'm going to highlight one that might be most different from what providers currently do or don't do if they're not a child care assistance program provider. And that's keeping daily attendance records for all the children who are receiving child care. Those attendance records need to include the date of care, the first and last name of each child in attendance, and then the times when those children are dropped off and picked up, which must be documented by the person dropping off or picking up the child to the extent possible. And there's more information about other record keeping requirements in our provider guide, which is also on our website. There's a big button there that takes you right to the guide, so you can look over that. And I do just want to highlight that electronic attendance systems can be used to meet these requirements. And attendance record keeping is actually a requirement of another state program that you would have access to as a child care assistance program provider. And that's the Great Start Compensation Support Payment Program. Just want to preface this with I'm not from the Great Start Compensation Support Program, so I'm not an expert here, but I can share some basic information. The program was signed into law of May of 2023, so it's relatively new, but it's been extremely impactful because it's a program that gives Minnesota permanent funding to support the childcare industry and childcare educators. So providers who are eligible, including certified providers, get monthly payment amounts that are determined by the number of full-time staff who regularly care with children. The program defines a full-time staff member as somebody who works 32 hours a week. And the amount right now for that is $375 per full-time staff person. Another benefit for you is if you've received Child Care Assistance Program or Early Learning Scholarship payments during the application period or the period where they look back for that data, or if you're located in a child care access equity area, you get another 10% bonus to your award amount. So even more assistance to you and your program. There is a web page that gives more information about the Great Start Compensation Support Payment Program. I will put that in the chat so you can look at that too. There's a very comprehensive FAQ that you can look at, but 2 great programs that you would have access to as a certified site.
Yes.
Thank you.
Thanks, Brianne. Thanks for all of your information and for your clarification, as well as for covering for a Great Start Compensation Support Payment Program. As you can see and hear, I mean, there's some financial, besides all of the other benefits, but some really financial benefits to your program as well as to the staff in your program. And so, I mean, pretty exciting stuff. So again, thanks, Brianne. We are going to talk now about preparing to apply. And I'm going to hand things over to Renna, and she's going to go through this next section, and I will see you back later.
All right. Thanks so much, Lisa.
You bet.
All right. So the first thing we need to talk about is understanding the actual application process. So the process to obtain certification is just that. It is a process. The first step is preparing to apply. Ensuring that you've gathered all of the items and information that you need in advance will help your submission of the application go smoothly. In phase one, you start new applications or an application. That includes uploading of policies and procedures, the floor plan, and a fire inspection if available. And those all have to be uploaded into the provider hub, which we'll talk about in a little bit here. And then phase two, once a licensor has approved the policies and procedures, you're going to be prompted to enter staffing information in the provider hub. And then this phase includes final approval of all requirements, including those background studies. And then lastly, certification. Certification is granted once all of the items are approved, including a scheduled phone meeting with the licensor. After becoming certified, requirements are maintained and certification reviews begin. Today, we're going to first take you through the process. So, where do I find the provider hub in order to apply? Applications must be completed and submitted through the provider hub. Links to the provider hub can be found on both the main web page for certified centers and the application web page. And links to these web pages are also found in your handout. So, phase one, initiating the application. We will now begin to share about preparing to apply and the actual process of applying for certification in the state's provider hub. Just to note, a few years ago during the legislative session, legislators funded a new streamlined electronic-based process to be developed for child care programs to use to ease various paperwork documentation and communication with DHS and DCYF. The provider hub launched for certified child care programs in April of 2023 and for licensed child care in November of 2023. And it's planned to launch for licensed family child care programs sometime next year. With that, know that the provider hub is still relatively new and continues to be enhanced and developed. Therefore, a sharing about the process is still new and could change a bit as more features are developed and released. What we are presenting today is current as of now. And even if some things are enhanced in the future, this presentation should at least give you a foundation of the provider hub experience. We have information about the Child Care Systems Transformation Project, which that's what the creation of the Provider Hub went through, and the online Provider Hub. Those are all, again, in your handout. So now I'm going to hand it off to one of our experts about the Provider Hub, Ms. Katie Lane. So Katie, you can take off with your slides.
Thanks so much. Hey, Renna.
Hi.
Hey, everybody. Thanks for being here. My name is Katie Lane. I work with a team that is putting together learning resources for you to understand how to use the Provider Hub. So I want to run through some of those resources. So if you get stuck or have questions along the way of doing the nitty-gritty work of completing that application, want to make sure you know how to get to those resources. So here we have a screenshot of that Provider Hub. I'm going to drop a link. Again, like Lisa said, Renna said, there are links in your handout that you're going to get to log into the Provider Hub or create a new account. I'll also drop that in the chat. But this is the hub, the place where you are going to manage any existing certifications that you have or apply for a new certification. So I can go to the next slide. There are 3 key ways to get help and resources in the Provider Hub. We have a Provider Hub Getting Started webpage for you. There are help and resources within the hub once you've logged in. And we also have our product support team that are people here in Minnesota who can help you over the phone or by submitting a support case. So let me tell you first about our Getting Started webpage. You can go to the next slide. The Getting Started webpage is a place to go for help and resources before you even log in. You can filter any kind of resources like training resources, getting started resources by your provider type. So click on certified centers when you get there. We're working to develop all of these training resources we have into 4 different languages. So it is more widely accessible to all of our certified providers. I'm also going to drop a link in the chat to this website too. You can go check it out. And please know that my team is adding resources regularly. We're still creating all kinds of training resources so you can feel prepared when you start to use the hub. You can go to the next slide. The next place you can find support is within the Help and Resources tab when you log into the hub. In the upper right corner, you'll see a More option, and you can select that drop down to get to Help and Resources. And from there, you can search for a variety of knowledge articles or help articles to understand what you need to do. I'm seeing some questions in the chat. Let me scroll up a little bit. Oh my gosh, how do I make this window not tiny? Okay, so I'm just reading these, scrolling through my tiny little chat. The difference between a licensed and certified child care center. I know the difference, but I want to let one of my experts answer that. And actually, I'm going to put that on the shelf for now until I get through some of these help and resources, but want to be sure that question is answered. So again, you can, once you're in the provider hub, you can go to that help and resources tab to search for some knowledge articles with step-by-step instructions. Go to the next slide. The last option for getting help and support is through contacting our product support team. Don't tell my other colleagues this, but these are some of my favorite people I work with. When you call in to get help, you'll be connected with Michael K. He's going to ask you what kind of concern you're having, what the problem is, and then he's going to connect you with one of our team members who is an expert in that area. You can also submit a support case within the Provider Hub. Every single page of the Provider Hub has a need assistance section at the bottom of every page where you can submit a support case. If any of this is like, Katie, this all feels really nebulous, like how do I even do these things? We've got you covered. On that Provider Hub Getting Started webpage, we have how-to guides, hub basic guides on how to do all of these things. You can find those resources there. So for logging into the Provider Hub, this is the last thing I'm going to share with you all. To get started in the Provider Hub, you'll go to providerhub.mn.gov. As a new certification holder, if this is your first time wanting to apply, you will need to create an account. And from there, you'll ask to put in your name, email, your preferred language, and then you will receive some more email instructions for setup. If you are already a certified provider and want to manage your account or opening up a new certification, you would use that existing account sign in. And again, if you get stuck at any part of this process along the way, we have help and resources guides on that Getting Started webpage, and you can also get in touch with our product support team. I'm going to pause here. Any questions about Provider Hub resources?
There's nothing in the chat right now about the Provider Hub resources, Katie. So I think if they pop on, that we don't allow the participants to unmute themselves, so it'd have to come in through that chat. But
oh, great, thank you. Thanks. But please, we are developing resources all the time to make sure that the hub process is smooth. And again, if you do get stuck, we got people at the ready to help you out. Thanks
great.
So much.
Thanks, Katie.
Yeah.
All right. Well, we really appreciate that, because obviously that's kind of the first step, is making sure that everyone understands how to complete the application and how to get the help that they need. So the tech readiness resource is a really good one too. So, well, once you're logged into that Provider Hub, you're going to need to select your exemption. So this is where you're going to have to designate the application criteria by identifying which exemption from licensure that your center meets. And reminder again that all childcare in Minnesota must be licensed unless it meets that exemption. Exclusions will be verified by support staff. So if you have questions about meeting an exclusion, reach out to your licensor on call, or not your licensor, the licensor on call for more information. And the number for the licensor on call is included in the handout. It's also on our web pages. So next, for role definitions. In certification, the center operator generally is the one who completes the application and identifies who the authorized agent is for the certification holder. For example, the school district or the program organization. The authorized agent receives access after certification is granted. So let's talk about some role definitions that will be helpful for you to understand. So again, certification holder, the organization name that is legally responsible for the operation of the center and granted certification by the commissioner. And then the authorized agent is the individual that will communicate with DHS on all matters relating to the certification. Authorized agents have full access to the functions in the provider hub and is the person who assigns others to roles in the hub. Authorized agents designate who will be the sensitive information person, or sometimes referred to as the SIP, to handle sensitive private information from background studies and initiate studies for study subjects in Net Study 2.0. This individual will be contacted by background studies to designate an individual who will be responsible for background studies for the certified center. If your certified program is affiliated with a licensed program, the authorized agent at the certified program needs to be the same person as the licensed program. The authorized agent is not typically a center operator, but they can be. The center operator is the person exercising supervision or control over the center's operations, planning, and functioning. Typically, the person completing the application and identifies who the authorized agent is for the organization. The center name, this is the name of the child care center. And if there is more than one center, the naming conventions should be center specific. Director, that's a person that meets certification requirements for a director from statute. So there is a definition for director in statute for certification and must assign a designee in their absence during operating hours. Note that there is an opportunity to designate a director and give delegated authority within the hub, but that will occur after certification is granted. Center operators will submit application information. So for example, center operator is the school age coordinator and the authorized agent is the community ed director. Or the center operator is a supervisor of the program and authorized agent is the director of the organization. In some instances, the center operator is the authorized agent. All of this depends on the size and the structure of the program. With regards to school districts, parks and recs, YMCA, etc., school districts, the AA should be the same as what is listed with the Minnesota Department of Education. And then the AA is the authorized agent. So that AA should be the person at the level that oversees all programs for the organization. If there are multiple programs within the organization and more than one center operator, only the authorized agent has access to all of the programs. For functionality within the provider hub, if there are certified and licensed programs within the organization, like I said before, the authorized agent should be the same person. That's a lot, I know, but more information, of course, about these roles are included in your handout. So this next chart here shows the various levels of access to functions in the provider hub based on role. Authorized agents are able to view information in the hub, create new users or edit user access, submit a new application, draft a change request, approve a change for submission, update or add program information and personnel, and close a program. The authorized agent needs to grant delegated authority to the center operator unless the center operator is the one who starts the first application for the certification holder. If that is the case, the center operator automatically has the authority to complete the entire application process and names the authorized agent. In this case, the authorized agent does not submit or approve the submission. Center operators always have the same authority as delegated authorities once named by the authorized agent or when that person starts an application as just described. Delegated authorities can view information in the hub, draft a change request, approve a change for submission, and update or add program information and personnel information. The create/submit level of access can view information in the hub, draft a change request, and update or add program information and personnel. And then read-only access is just that. The users can only see information in the hub, but it's not allowed to make any changes or submissions. So certification holder and ownership documentation. The certification holder is the organization name that is legally responsible for the operation of the center and granted certification by the commissioner. For example, Community Action Partnership of Ramsey and Washington Counties, Tri-Valley Opportunity Council, Minnesota Valley Action Council Incorporated, Parents in Community Action, all of those types. Exclusion from licensure will again be verified by support staff while the application is being processed. While you do not need to submit ownership documentation as it's not required in Statute 245H, the area to upload is available, but you can bypass this and move forward without uploading. But ownership documentation or government entity application authorization documents are, for government entities, a letter signed by the manager, administrator, or other executive of the government entity authorizing the submission of the license application. For organizations, a copy of the most recent Minnesota Secretary of State filing of the business's legal name, or documents that created by the organization and identify the individuals who make decisions about the operation of the program, such as partnership agreement, articles of organization, articles of incorporation, bylaws, or an operating agreement. And then for individuals, submit documentation of your business's legal name as filed with the Minnesota Secretary of State, if applicable. So authorized agent and center operator in the provider hub. So this is the step in the process where you will identify and complete contact information for the authorized agent and center operator roles. When entering someone's name, enter their full legal name so that it matches their legal identification and will align with all systems such as background studies, Net Study 2.0. Next, after you have identified the AA and center operator, you will click Next and be brought to this screen where you are asked to upload your policies and procedures. So when you develop your policies and procedures, it is critical to follow the guidelines for developing policies and procedures for certified centers document that has been created by us and DHS to ensure that all of the required policies and procedures are created to meet all requirements in statute. Each policy will need to be uploaded separately with its own unique title rather than one document of all of the policies uploaded multiple times. Please do not do that. At this point in the process, the policies and procedures you upload would be those that would apply to all of the programs you are applying for. Later in this process, you will have the opportunity to upload additional policies and procedures that are site specific, such as the individual site's risk reduction plan and emergency preparedness plan. Once program policies are submitted, these policies will be reviewed by us at DHS to either approve or reject. And if rejected, the policy will need to be revised and uploaded into the hub again for us to review again. Now, for reporting requirements, certified centers must comply with the reporting requirements for abuse and neglect as specified in Minnesota Statutes Chapter 260E, that's the Reporting of Maltreatment of Minors Act, and must upload their policy that matches the reporting policy requirements. A person mandated to report physical or sexual abuse or neglect occurring within a certified center must report the information to DHS, and certified centers must have written policies for staff to comply with reporting requirements. The DHS Maltreatment Investigations and DHS License Programs webpage has additional information on the maltreatment investigation process, alerts for providers to reduce risks in child care centers, and mandated reporter resources, including a resource guide for mandated reporters of child maltreatment concerns and mandated reporter training videos. Certified centers must have a policy on reporting that includes informing DHS within 24 hours of the death of a child in care at the program and 24 hours of any injury to a child in the certified center that requires treatment by a physician. A serious injury is defined as an injury to a child that required treatment by a physician or advanced practice registered nurse. This also includes treatment by a dentist. If a child goes to a doctor but does not require treatment, it would not be considered a serious injury. Certified centers must use the DHS Child Care and Serious Injury and Death Reporting Form. Please note, Internet Explorer or Edge are the preferred browser types to use with this form. If you use Chrome, the send button will not work on the form. You can, however, email the form directly to dhs.licensingccsupport@state.mn.us. So next, for number of programs. So the center operator must input the number of programs applying for certification. Programs are defined as individual centers or site locations. Only choose multiple programs if the certification holder oversees multiple locations. After this, next in the provider hub, you will be asked to acknowledge each attestation statement by clicking each box shown on this screen here. And then next slide, applicants are agreeing to the following statements when applying for certification. The center operator will receive a written notice from the DHS licensing division identifying any documents that are missing or deficient and be given 45 days to resubmit documents that are substantially complete. Failure to submit substantially complete documents within 45 days from notice is a basis for certification denial. The person designated as the authorized agent will receive an email from DHS and will be required to create a NetStudy 2.0 account for submitting background study requests. Applicants must be compliant with all applicable laws and statutory requirements, or certification will not be issued. Certification is not transferable to any other person or organization, and that any future owners of this business must apply for a new certification number. You have to attest that the information provided on the application is true, accurate, and complete. If the Commissioner of Human Services grants certification, comply with the requirements contained in Minnesota statutes, Chapter 245H, and all applicable laws at all times during the terms of certification. The documentation and inspection required by statute is necessary for the Commissioner to determine whether Minnesota laws are being complied with. And lastly, the Commissioner may issue a correction order or decertify a center if an applicant or certification holder fails to comply with the applicable laws or knowingly withholds relevant information from or gives false or misleading information to the Commissioner in connection with the application for certification or during an investigation. So after you agree to the attestations on the previous page, you will be directed to a page where each site or sites are listed and be asked then to complete the application for each site. The Continue Application button is there for each program and must be completed. Identifying information for each program must be entered. You will now be in the draft phase for the location or locations. You're going to click on Continue Application for the first location if applying for multiple locations. And each location will need to be entered separately. Enter the program name, address of the physical location, and select the age category served by the program. This slide shows the age categories for each age category, maximum group sizes, and staff to child ratios. Kindergarten includes a child that is of sufficient age to have attended the first day of kindergarten or who is eligible to enter kindergarten within the next 4 months. Certified centers may serve a child that is 14 years old if either the child remains eligible for the Child Care Assistance Program or if the center serves only school-age children in a setting that has students enrolled in no grade higher than 8th grade. If middle school-aged children are enrolled and combined with elementary children, the risk reduction plan must include policies and procedures to ensure adequate supervision when those children are grouped together. Maximum group size is the maximum number of children that can be involved in a group activity at any one time. The maximum group size applies at all times, except during group activity coordination time not exceeding 15 minutes, during a meal, outdoor activity, field trip, or naps and rest, or during special activity, including a film or a guest speaker or an indoor large muscle activity or a holiday program. Maximum group size applies to instances where all children are participating in one activity. This would not include having more than the maximum group size in a space participating in different activities. So for example, 90 school-age children could be in one cafeteria space as long as they are participating in 3 or more separate activities. So next slide. This is a screenshot of the provider hub for the process we just addressed on the previous slide. What name is used for the program will be pulled from here into other data systems and used to designate the site. NetStudy 2.0, CCAP, Parent Aware, etc. Next slide is where schedules of operating hours are addressed. So schedules will need to be entered for the hours the program will serve children. If the program will have a separate schedule during, say, summer hours or during holiday hours, those changes need to be entered with start and end dates. Applicants will need to indicate the time period that the schedule is effective and the hours the program will operate. If the program will have the same schedule year-round, the end date can just be left blank. It is important to note that schedules may not overlap. You will enter operating hours for the program, including the operating schedule and daily schedule for this particular program. If the schedule, again, is different during different parts of the year, such as during summer, you will add a section to complete for that time frame. The policies on the left side of the slide may have been uploaded in the previous step of the application process. And if providers choose to use the same policy that's already been uploaded, there is an option to check a box to use that previously submitted policy. But there's not an option to use this feature for the emergency preparedness plan or the risk reduction plan, because the emergency plan and the risk reduction plan are specific to each location. And then also, as a note, the emergency preparedness plan is required to be submitted on our form, DHS form 7995, the Child Care Emergency Plan. The risk reduction plan can be submitted using our form. Doesn't have to be, but it's very helpful to use our form, and that's DHS 7954B. Again, links to those are on our websites and in the handout. So both forms can be found, again, like I said, on the Certified Center's webpage. As a reminder, staff cannot be trained on policies until after the policies and procedures have been approved by your licensor. So this next one here, this is a screenshot of the provider hub, and you can see the arrow pointing to the box that you can select if you are using the document you previously uploaded earlier on in the application process. You will see near the end of this list that there's those 2 policies that must be uploaded that were not included in the earlier step. So for each site and application, you will need to create different risk reduction plans and the emergency preparedness plans, and each developed to contain details unique to each specific site. So certified centers must have a policy for the emergency preparedness and response using the Child Care Emergency Plan form. This form is required and must be specific to each individual center. It is also required that staff are trained at orientation and at least once each calendar year on the center-specific emergency plan. Minnesota Statute 245H15 Subdivision 2 requires that the certified center must conduct at least quarterly 1 evacuation drill and 1 shelter-in-place drill. The date and time of those drills must be documented. An evacuation drill and a shelter in place, or some people call them tornado or lockdown drills, must be done in each quarter. A drill needs to be done during the operation times of the certified center. So the 4 quarters are as follows: the fall quarter, which includes September, October, and November; the winter quarter, which includes December, January, and February; the spring quarter, which includes March, April, and May; and then the summer quarter, which includes June, July, and August. All right, so next slide there. During this step, you're asked to upload a floor plan of the facility outlining the space used for childcare, both indoors and outdoors. In addition, a current fire inspection must be submitted. Fire inspections must have occurred within the last 3 years to be considered current. For programs located in a public school building, an approved fire inspection may have already been completed and you can provide documentation from your school. Both documents will need to be uploaded when you're at this point in the application process, unless you check the box stating that you do not have a current fire inspection. So note, if you do click that box saying that you do not have a current fire inspection and submit the application, your program cannot be certified until you can provide a current fire inspection. If you designate that your site needs a fire inspection once submitted, your licensor working on your application will initiate a fire inspection to be completed by the state fire marshal or approved local inspector. So important information about fire inspections. The state fire marshal has created a resource showing the step-by-step process individuals can follow before a fire inspection is requested by DHS for a program and application. The interagency inspection requests for DHS licensed or certified child care facilities PDF can be found on the State Fire Marshal website and is included in your handout. Next slide, you are now at the step where you can either choose next to return to your application summary or choose previous to review the information that you just entered for the particular site you were submitting for. If you are applying for certification at more than one site, you will head back to the application summary where you can move on to the next site and enter that center-specific information for that program. On this slide, you can see the example here shows that this person is applying for certification for 3 different sites. Since they designated 3 programs, until all info is entered for all 3 programs, they can't submit the application. So now view applications and submit. Once all of the site-specific information has been entered and each location shows view application, you can then hit the submit button to complete this stage of the submission. For homepage after submitted application, once the application has been submitted, you then can watch your homepage for status updates. Additionally, the indicated authorized agent will receive emails as the application moves through the process. This is an example of the homepage that shows some of what you might see. These are not actual locations or programs. This screenshot just was taken from our like sandbox of the Provider Hub. Next slide here. At this point, as an applicant, you now watch for correspondence back from DHS in the Provider Hub and via email. Providers will receive an email notification when action is required from them on their application. This means that DHS needs additional information or clarification to move the application forward to the next phase of the application process. So here is an example of what the email will look like. If either something was missing or needs clarification, or if all looks good upon initial review, you will receive notification that you are ready to begin entering personnel information. So now I'm going to hand things back to Lisa to take us through that.
Yes, thanks, Rena.
You bet.
It's a lot of information, and we've kind of hit a good time for a little bit of a break. So we are going to take about a 4 or 5 minute break. We'll come back around 10:10. So get up, stand, stretch, process some of the information you've just received, and then we're going to move on to some information about staffing requirements for certification. So we will see you back at 10:10. All right. We are hopefully coming back from break. I hope you had a chance to get up and stretch and sort of again process some of the information you received. I want to remind everyone that we do have a panel here. So your questions, anything you think of throughout this presentation, they're super valuable to us to hear, as well as for us to be able to answer. We want all questions answered. So please feel free to put any questions you have in the chat as they come to you. So now we're going to move into what we call as phase 2, and that is where we discuss or have requirements about staffing. So we will go through the various staffing requirements for certification. So again, these requirements come from Minnesota Statute 245H currently, and there are qualifications for a director. So certification cannot be granted until the program has at least a director hired and entered into the provider hub. The director must be at least 18 years of age or older and have completed at least 16 hours of training in any of the following topic areas, whether it's child development and learning, developmentally appropriate learning experiences, relationships with families, assessment, evaluation, and individualization, historical and contemporary development of early childhood education, professionalism, and health and safety and nutrition categories. So again, at least 16 hours of training in specific topic areas of the, as mentioned. Certified centers must have, again, a director, and if the director is not on site, they must have a designee. Designees must not, or the designee does not need to meet the requirements of a director, but must know that they have been assigned as the designee. A designee must be named whenever the program or the director is not at the program. Staff now for a program must be at least 16 years of age or older. And there are additional training requirements for staff before direct contact with children that can occur that we will discuss later in this presentation. Now we've come to the area in the provider hub where there will be a request for some personal record requirements. And to comply with these federal requirements, Minnesota Statute 245H specifies what needs to be kept in these personnel records. So the personnel record requirements include that each person's staff or each staff person's name, role, home address, telephone number, and date of birth is kept on file. Documentation of completed training specified in Minnesota Statute Section 245H.14 must be documented in the provider hub, and documentation of the date of the program initiated a background study for a staff person must also be entered. Documentation of the date the staff person had direct contact for the first time and access to a child while supervised, and the date, okay, let me clear that up. Documentation of the date the staff person had direct contact or access to a child while supervised must be documented. And then also the date that the staff person had first had direct contact, access to a child while unsupervised. Both of those dates need to be documented. Currently, the feature to enter the address and phone number into the provider hub for staff is still being developed. Therefore, the licensor will ask, they'll reach out to ask for that information via email. So for that reason, you must also maintain personnel record information on site. Another thing to note is when you enter someone's name into the provider hub, it's recommended that you enter the person's legal name that matches their legal identification, such as their driver's license or passport, whatever they are using to initiate a background study. So it's important that those match up. This will just ease the connections as more and more parts of the provider hub are connecting, such as that background study subject. information. In the Provider Hub, you will be asked to enter personnel information for each employee, starting with the director. So again, this information must also be maintained in each director's personnel file on site for now. Directors must meet qualifications, as I've mentioned, as required in Minnesota Statute, Section 245H.08, Subdivision 2. So if you want to look it up and see exactly how it's written, you can look it up there. During the hours of operation, a certified center must have a director or its designee on site who is responsible for overseeing the implementation of written policies relating to the management and control of the daily activities of the program and ensuring the health and safety of the program participants and supervising staff and volunteers is intact. So after you enter contact information in the Provider Hub, you will begin entering training information that meets the required topics for a director, as I mentioned before. There is an add button that will allow you to add additional lines for more trainings. So you can enter that in. And as Ren and I have walked through, you can see the Provider Hub really does walk you through all of these requirements. So while it might seem like we're telling you a lot of information, as you go through the process, it is going to walk you through it step by step. And you can see too, as shown on many of the slides, there's on the right side of the Provider Hub here, there's a list that shows you what step you're at and then additional steps to come. So it's a real nice process to be able to walk through as you're doing all of this. Here is kind of a visual of that step in the Provider Hub where you will add information. And this one here is the summary of personnel. So this screenshot here shows a depiction of what you might expect it to look like in the Provider Hub with those fields about entering any identifying information for each staff or each volunteer, program support staff, if you have a driver, if you've got a site contact or a CCAP payment contact, or anyone else that is affiliated with your program that might be required to be, that information might be required to be entered. So based on the role chosen on the screen for each person, you will then enter the information in the various fields that pop up for that person. So again, the Provider Hub has been developed to really just, share with you information that is needed and required. And then depending on the role, it might be different. And so only the fields that are required, for each role will be there for you. So the blue add personnel button on the bottom, as shown here, that is the button that you will push to save information, and it brings you back to the list of personnel where you can then continue to add additional people. So when you are done adding all personnel, then you will hit the next button. There is also in the Provider Hub a search feature that is available to see if you have already, staff that might already be connected with your organization. And if that's the case, then that information can be pulled. All right, then on this slide, we actually have two different screenshots, one on the top here and one on the bottom that come directly out of the Provider Hub. On the top area here, you will see that next button that I mentioned that you will push to bring you back to bring you to what you see here on the bottom screenshot. And so when you hit that next button, you will return to the application summary. And once you hit that, you hit submit in the bottom left, that circle down here, that's when the application will get sent to the licensor for review. Now, if there is more action needed, such as something missing or needing to be corrected, you will receive a notification email indicating that more information is needed. So when somebody receives these email notifications, there should also be a more detailed letter in the Provider Hub that offers greater detail. So it's there is more information that is being provided. Once everything does or is approved from what is submitted in the hub, before becoming certified, our certification licenser assigned to your program will set up a phone call meeting to go over everything about their certification with your center operator. So whoever is listed as your center operator will be that person that the licensor will reach out to go over all of the information that has been submitted. And the center operator will be notified once certification is granted. Now, we've mentioned the background study process previously because background studies are required for programs, and we're going to go a little bit more into detail about that. So, about background studies. State law requires background studies for individuals who are employed by the Child Care Center and individuals who provide direct contact services or have access to children. The background study determines whether a person has a disqualifying characteristic which could prevent the person from being in a certain job or position. So that's why it's important that these background studies be done early in the process, and why we're going through it now with you here. So applicants must be cleared before centers can be certified. So the applicant, that again, the process is early on. Prospective and current staff need to be cleared before starting assigned duties. And then some volunteers and contractors will also need background studies. For that reason, and because there are various roles and there could be some confusion with that, there has been guidance created for certified child care centers on background study requirements and who needs a background study. And so there's a link in your handout about that is for certified child care center background study worksheet, and that there is is a background study needed or required. And so that gives you guidance to understand who in your program might need a background study. Once your application is received, it does get sent to our licensing unit support staff, who do an initial review to make certain identifying information is properly submitted. And they do that before it does get assigned to a licenser. So once the licensing support staff, does their initial review, that will prompt an email from NetStudy 2.0 from the state of Minnesota. It's dhs.netstudy2@state.mn.us. That email will be prompted to be sent out to the designated authorized agent of the program. So it might even be before you hear from a licenser that you receive notice to start running background studies. The email that you receive from NetStudy 2.0 will contain login and password information for NetStudy 2. The system, that whole system, it's an application system that you go into and create, again, login and password information. The authorized agent is the person that receives that. And that authorized agent is also the person who designates somebody referred to as a sensitive information program or person, a SIP. And that individual will have access to sensitive information in the background study web app, NetStudy 2.0. The SIP, sensitive information person, should begin background studies on controlling individuals as soon as the account in NetStudy 2.0 is available, because some studies do take longer than others to complete, such as like if an individual, if an applicant has lived in another state within the last 5 years, there has to be a coordinated effort between state systems to get information. And so sometimes it does take some time. And therefore, again, why you might, again, receive that email to start background studies, very early in the process. DHS Background Studies Division within, again, a partner of ours within the Minnesota Department of Human Services currently, has extensive information on their website to offer greater information about the process of background studies and how to, where to start. They have an FAQ page that covers various questions that come in. And again, there's a lot of information about background studies in the handout you received for today's session, including links to a lot of resources that have been developed. For certified childcare centers, again, certified childcare centers are required to comply with background studies requirements in Minnesota Statute 245C. That email to the authorized agent with instructions will come early. The authorized agent will designate a sensitive information person as the individual with access to the sensitive information in Net Study 2.0. And information and instructions, again, are available on the website and in your handout. To prevent delays getting access to the background study application, you want to ensure that the contact person's email address is accurate. And after the application fee has cleared in background studies, if an email is not received soon after, or at any time from DHS, you want to check your junk or spam folders for any emails that might come in. So if you don't receive an email pretty early in the process from DHS in your regular email, check your spam for that background studies email. It's important to note that the type of background study that people associated with childcare programs is unique due to specific federal requirements and laws. We're often asked about other kinds of background studies, such as studies that are required of people that work in schools, as K-12 school. Those studies are different. Again, studies for childcare programs must meet specific requirements and federal requirements, and therefore they are not the same. And so if a person is working in a childcare center, they must have this unique type of background study. The studies required for childcare are referenced or referred as enhanced studies and do require a photograph and fingerprints. The department began implementing enhanced background studies in 2018 for all licensed childcare programs, all certified licensed exempt centers, and non-licensed providers participating in CCAP. And again, these enhanced studies are required by federal law. The steps here shown on this slide illustrate the process for study subjects to follow when they are submitting or applying for a background study. And these steps come right from some of those resources I've mentioned that are referenced and linked in the handout from the Background Studies Division. So I'm not going to go through them step by step. There are some helpful background study tips that we have received from just experience and from our licensors, because our licensors do work so closely with programs. They have kind of learned where some areas can be little hiccups for programs as they go through the process. So some tips they've offered for us to share is that when someone is entering a study subject's name into Net Study 2.0, you want to make sure that you include any middle name or initial, whatever is being shown on a person's identifying photo that they will use to connect to their background study application should match, or it must match. So if an ID that they have, has their full name or their middle name or just an initial, then you want it to match up so that the individual's study can proceed. Otherwise, there may be a problem when they go to, get their background study fingerprints and photo taken. Here's another tip. An individual's social security number is not required to be provided on a background study. However, if the study subject does include it when they fill out the information, having that information in there may allow a study to be transferable to other child care programs without having to pay for a new study for 5 years. So that's important. It's a nice little tip for study subjects to understand. Also, you will want to encourage study subjects to get their fingerprints and photos scheduled and scanned within the time frame they are given, because they are going to, once the the SIP enters and initiates a study for a subject, so for a person, that person's going to get an email. And in that email, they're going to receive a time frame for them to get their background study completed. If they do not get their study, their fingerprints, and their photo taken within that fingerprinting window, and that window expires before that fingerprint is taken and fingerprints are scanned, then initiating another painting for a study might be required. We in Minnesota, we use Identigo by IDEMIA as our DHS fingerprinting vendor, and they have sites that are expanding throughout the state all the time. And there's information about IDEMIA, all of those different various sites, so you can access that, including they have information on an FAQ webpage too, specific to the process that you will, go through right, when you are at the fingerprint vendor. So important information, and a lot of it has been developed for you already. Now I'm going to hand things back to Renna to do a little bit about staff training, and then I'll see you back in a bit.
Perfect. Thanks, Lisa. Yeah, I just have a couple of slides to go through with you about staff training that's required. So first off, pediatric first aid and pediatric CPR. So all staff must complete pediatric first aid and pediatric CPR training before having unsupervised direct contact with children and within 90 days of employment. As well, this training must be repeated every 2 years thereafter. Next, we're going to talk about the orientation. So directors and all staff must complete an orientation within 14 days after first direct contact with children. Health and safety policies include sick children, immunizations, medications, allergies, hazards, and transporting. This needs to be done for all staff after the policies have been approved. Staff must be supervised by a person that's already completed the trainings until the orientation is completed. SUID, which is sudden unexpected infant death, training must occur prior to caring for infants under age 1 if it's applicable, and abusive head trauma training must occur prior to caring for children under school age. And child development and learning training must occur prior to unsupervised direct contact with a child and within 90 days of first direct contact with a child. After you have your staff hired and they have completed their orientation, they still have yearly then in-service training requirements. The director and each staff person, not including substitutes, must complete at least 6 hours of training each calendar year. Staff must be trained each year on the following. MOMA, which is the mandated reporting, the Maltreatment of Minors Act reporting, need to be trained on that. All of the health and safety policies, the risk reduction plan, behavior guidance, supervision, child development, SUID and AHT, so that's that sudden unexpected infant death, and abusive head trauma training if either of those conditions are applicable, the emergency preparedness plan, and then all of this training must be documented. So that's it for me, and I'm going to hand it back to Lisa.
All right. So once a program is certified, you might be asking, what's next? What do I expect? So we're going to go over that now. So once certified centers will have a certification review once a year. These reviews are coordinated and scheduled. The licensor assigned to the program will communicate with the center operator to schedule a review. Licensing does not determine a time frame for when the review will take, or does determine a time frame for when a review will take place. For example, a licensor will call the center operator and maybe say, I'm planning to come or conduct your annual review in September. What days might your program be closed? And they will really try to work with you on that. Also note that certified licensors do conduct investigations for certification allegations at times, if necessary. So in that case, a certified licensor may just show up unannounced for an investigation, or based on the type of seriousness of the allegation that is received to DHS, you could also see an investigator from the DHS intake and investigation unit. So again, most of those yearly reviews are scheduled. However, if there's an investigation that needs to occur, you might see either a licensor that is assigned to your program, or from our licensing division, or one of our colleagues from the intake and investigations unit, again, based on the type of allegation that might instigate an investigation. So personnel and child record requirements. There are personnel records that must be maintained for each staff person and include that staff name, address, phone number, and date of birth. Documentation of training as required by section 245H.14, as mentioned. And then documentation of the date the program initiated a background study for staff, the date of first direct contact access to children while supervised, and date of unsupervised contact access with a child. Children's records. Now, for children's records, new legislation has occurred and will be required as our DHS licensing and certification units moves into DCYF. And so for now, we are advising everybody of the requirements and providing technical support to help our current programs understand that for children's records, you will need to include full name of a child's birth date, child's home address, parent or guardian's names and phone numbers, an emergency contact name and phone number, who is not the child's parent or guardian, authorized pickup names or pickup people's name and phone number, proof of immunization, and medication authorization if applicable. Records must be accessible at all times that the program is operating. And so, for example, as we move into DCYF, we will be watching to see if immunizations are kept, they must be kept on site, those records. And if not, we're asking programs to, or if they don't have them right away or accessible when our licensor is visiting, or maybe there for an investigation. If they are kept at a central building or location, each location needs to have a plan on how they can access those immunization records at all times, so that their program is operating. So again, our licensors and investigators must have access to those records. Evacuation and shelter in place drills, as Rena mentioned earlier, Minnesota State 245H Statute 245H.15 Subdivision 2 requires that certified childcare centers must conduct at least quarterly one evacuation drill and one shelter in place drill, and documentation of those must occur. So the date and time of drills must be documented and accessible for our licensors. So an evacuation drill and shelter in place, such as a tornado or a lockdown drill, must be done each quarter. A drill needs to be during the operation hours of the certified center. And as mentioned before, they need to occur in the fall, which we designate as September, October, November. Winter quarter, December, January, February. Spring quarter is March, April, May. And summer quarter is June, July, August. We do have drill logs that are available and have been created by DHS, listed on our Certified Childcare Center webpage under Forms and Documents. And it's available there for use. And any of the documents that we have there for our certified program, those documents are there to help you stay on track to what is required for documentation purposes. So make sure to check those out and use those. Okay, changes to certification. So once certification is granted, any changes that occur for your program must be requested in the provider hub before they are granted. So if certified programs need to change the program's name, location, age categories served, days or hours of operation, or update the status of certification, the authorized agent will go into the provider hub and select the change being requested within within this area of the provider hub. If the change being requested is required or regarding a change in the program's location, whether the change is to a new location, a new space within the same location, or to a newly constructed space within the same building, it will need to be indicated. Once the change request has been approved or denied by the licensor, or if more information is required, a notification will occur in the provider hub. And if there's a denial that comes back in the provider hub, it doesn't mean that it's going to be completely denied. It just might mean that there's more information or more steps that need to be taken before that area or that space is approved. So just to clarify that. The information you do provide to DHS about your program must be accurate and be kept up to date. Upon implementation of the provider licensing and reporting hub, certification holders must enter and update information in the hub in a manner prescribed by the commissioner. So, and another change we often see from our certified programs are changes related to their operating hours. Many certified centers experience seasonal changes during the transition from school year to summer with regard to their operating hours. But we do want to remind everybody or make note that all changes require a change request submitted within the provider hub for approval from your licensor. Instructions on how to submit a change request can be found in a lot of those help and resources within the provider hub. And change requests need to be submitted for each particular individual center. So you are also required to submit a floor plan of fire inspection that has been completed within the last 3 years with no open violations, an updated risk reduction plan, and emergency preparedness plan. Again, those need to be maintained as current and updated as updates need to be, that are made. All right. We want to allow people to, kind of process notes. So again, if a program becomes certified, you will have continued access and connection with our licensing and certification team. But we also want to point out that sometimes changes occur in requirements. Each year during the legislative session, there is a possibility that certification statutes could be altered or changed or updated, or new requirements could occur or be eliminated, whatever it is. We want you to know that once you're certified, to stay alert to legislative news regarding and related to childcare, as well as related specifically to certified childcare. And you can do that in numerous ways. Please note, our licensing and certification unit communicates very important information out to all of the programs when we feel it's important. We will not inundate you with a ton of extra emails unless we feel the information is super important for you to know. So anytime there is a change in a requirement, you will receive the information from us to your program about any requirement changes. We also update our website for that kind of information. But we also wanted you to know about the areas where Childcare Aware Minnesota has a bill tracker where you can follow along and see what kind of information is happening through the legislative process and watch to see if there's changes that will impact a program. But any important information that must be communicated out to our programs, we do send that out to our certified team or through our certified gov delivery to the authorized agent of your program. And we also communicate information through gov delivery emails that you can sign up for to receive specifics to certified childcare centers. And to do that, you would go to the Certified Childcare Center webpage where there's a sign up for information. So again, I recommend doing that just so that you're alert and aware of information. One thing we don't have on here, but we just recently did and hope to continue to do for our certified programs, is offer an outreach webinar from our Child Care Center Licensing and Certification Unit. In that webinar, we will also communicate any updates or information that we hear or know or think about that could be important to your programs and for you to know. With that too, we often invite in some of our partners that have information that could be beneficial for you to know about, such as various resources or support, or we've had speakers come in from background studies or from Minnesota Department of Health, or other areas from the Department of Children, Youth, and Families, just to kind of share information and so allow for you to ask questions. You will see, as stated on this, and as we've mentioned, our DHS Child Care Center licensing unit will be transferring over to the Department of Children, Youth, and Families. So what has always been referred to as DHS for our child care programs, whether certified or licensed, will be part of DCYF. And so we're all getting used to that and excited to be able to work even more closely with other units and departments that have all been pulled together to work more closely to support children, youth, and families throughout Minnesota. And so we're excited for that transition. And again, signing up for emails will allow you to stay up to date to information as that transition occurs. We want to remind people of the Provider Hub support, as Katie mentioned earlier. If you are looking for support as you go through this process regarding the Provider Hub, submit a case through the Provider Hub. Call that product support hotline, and again, navigate once you're in that child care or the Provider Hub. There's numerous resources in there as well for you to access. But we wanted you to know too that you have any specific questions, the CCC Provider Hub.dhs@state.mn.us is also available for you to email any information or questions you might have. And then two, here is the contact information for the Child Care Center Licensing and Certification Unit. For any application, licensing, or certification requirement questions, we highly recommend that you reach out to us. We have a licensor on call available Monday through Friday from 8 a.m. to 4:30 by phone or email. So, if you have a general question on a requirement for certification or even a requirement on licensing, that phone call or email is available for you to ask, and our licensors that take on that call center are very good about getting questions answered and back to you, much like our panel here. So again, shoot away if you have any questions in the chat to our panel as we wrap things up. For training related questions or comments or feedback regarding this training, you can contact Rena or myself. We are the two Child Care Center training specialists for the Child Care Center Licensing and Certification Unit. Our email is dhs.ccclictraining@state.mn.us. And we love to hear from the people that we share these webinars with to hear back, if you have any feedback or any questions specific to us. We also like to note, once you are assigned a licensor for your program, that licensor should always be your first point of contact because they will know specific information about your program. It is incredible when I talk to our licensors how they are able to really make a connection with the programs that they serve and work with, and monitor for compliance with. They just really know a lot about the programs that they're assigned, and so if you have specific questions, they are going to be your point of contact because they will know best how to serve your specific, unique program, because often our programs are very unique from one another. And for that, we want to say thank you. We have 11 extra minutes. So, we will stay on here for any further questions. And I want to open things up to our panel. If there's anything I have missed or Rena may have missed that you would like to add, feel free to join us now. Or if I haven't been able to watch the chat. So if there's any questions, please let me know that we need to stay on for.
No, everything's been answered by the panel so far, so that's great. There weren't a whole lot of questions today.
Great. I know we have a small group here, but we really do appreciate you guys all being here, and we will stay on for a couple more minutes before logging off. As I mentioned in the beginning, when you log off, a little pop-up will occur for a survey, and if there's anything we can do to, revise this webinar to make it better and answer more questions in the future, please share that with us so that we can do that for other people that are wanting information. So other than that, have a great day. Thank you so much for being here.
Evacuate. Yeah. No, they did lockdown. They did soft lockdown. Yeah. They didn't even.
John, you are unmuted. If you did want to ask a question, you certainly are welcome to do so.
I put it into the chat is more, do we have to say anything in particular to access the no cost background checks?
No, when you apply for a certified program, as of right now, that will
Automatically kick in.
correct.
Got
Correct. For
Okay.
in fact, actually, right now for all childcare, there is no fee.
Yeah,
Sounds
that's
good.
what I
DHS
wanted.
is covering those. Actually, I should say there's a fee, but DHS is covering those right now.
Okay, but there's nothing particular that needs to be said when we apply for those. So just,
No.
I didn't know if it was like a coupon code or a make sure you say this word.
A great question. Yeah,
That is a good question. Nope, it will just it's basically the net study system is programmed in a way that if you are identified and linked to child care, which happens behind the scenes, it will not cause or have a fee come up for you.
and again, these studies are specific to childcare.
Yes.
And so
Correct.
so that too, they're it's different than other types of background studies.
Yep, no, that's appreciated. We run a childcare as well, but just thought,
Yeah.
thinking about opening up a school age care, and we want to be certified in that. So it's just
Well,
making sure, okay, if we're going to hire all these folks, do we have to plan in for all these background check expenses? So
that's a
free for
very
bit,
good
that
question
helps.
and a good thing to plan for.
So,
And we were excited to hear that you're wanting to do this.
well, we're investigating it. We know we need to break even on it. So that's the question is, can we?
Right.
So taking a look at that as a school district. So, okay. Thank you
Well,
very
always
much.
reach out if you have any additional questions. That if nothing else, we want you to know that we're available to you, and have
Sounds good.
provided a lot of that information in our the handouts as well as on our webpage.
Yes. Perfect. Thank you so much for your time today.
Thank
Yeah,
you.
thanks for attending. Yep.